Optic nerve, optic tract, optic chiasm, optic radiation. Optic nerve is second cranial nerve, sensory and nerve of sight. It is not a true peripheral nerve but a tract of brain as an outgrowth of diencephalon. Some features. It consists of second order sensory neurons. Its fibers are myelinated by oligodendrocytes, surrounded by meninges, cannot regenerate if cut or damaged, carry sense of sight from visual field of corresponding eye. Course and relation arises from ganglion cell in neural layer of retina of eyeball, enters middle cranial fossa through optic canal. It forms optic chiasm by uniting two sides. Diverging from chiasm are optic tracts and most rarely in lateral geniculate body. Third order neuron arises in lateral geniculate, run in retrolenticular part of internal capsule and optic radiations, terminates in and around the calcarine sulcus of occipital lobe. Visual pathway, retina, optic nerve, optic tract, lateral geniculate body, optic radiation, visual cortex. Optic nerve, intraorbital, canalicular, intracranial, enclosed by three meninges of brain. So here you can see field of vision, nasal and temporal, left and right, retina, eyeball, optic nerve, optic chiasm, optic tract, temporal loop, Mayer's loop, lateral geniculate body, pretectal nucleus in pretectal area, optic radiation, calcarine sulcus. Clinical ipsilateral total blindness. It occurs due to damage of optic nerve or blockage of central artery of retina. The compression of optic nerve results in optic atrophy which subsequently leads to ipsilateral total blindness called anopia. Papilledema. The central vein of retina is enclosed in meninges of the anterior part of the optic nerve which is surrounded by CSF in the subarachnoid space. Therefore, an increased CSF pressure within the cranial cavity impedes the return of venous blood from the retina by pressing the central vein of retina and its tributaries. This results in swallowing of the optic disc owing to edema called papilledema. The papilledema is valuable clinical evidence of an increased intracranial pressure. Clinical testing of optic nerve. The optic nerve is tested clinically by performing tests for visual acuity, color perception, and loss of vision in different visual fields. Thank you.